Hello everyone, in this session we'll be learning about general anatomy of muscles from the anatomy decoded notes that we have made for you all. So muscles of the body, what you all know about it. Okay, muscle is a contractile tissue. Okay, muscle is a basic tissue, therefore basic tissues in the body, right? Epithelial, connective, muscle and the nervous tissue, out of which muscle tissue is a contractile tissue which brings about movements of an organ and also movement of body as a whole. Okay, and in general the muscles are classified under these three headings. Okay, either a muscle could be a skeletal muscle, or it could be a smooth muscle, or it could be a cardiac muscle. Okay, skeletal muscle means the muscles which are attached with the bones. Okay, skeleton means bones. Okay, the muscle which are attached on the bones, those are referred to as skeletal muscles. Okay, the majority of muscles in the body are skeletal muscles. Okay, so just to get a brief overview of how the skeletal muscles look like, just look at this image. So here we can see the skeletal muscles in an anterior view and skeletal muscles seen in a posterior view. Okay, so almost all the bones are covered by muscles. When we reflect the skin, superficial fascia, deep fascia, then the structure which is seen is the muscles. Okay, then look at this part. Here we can understand different parts of a skeletal muscle. Okay, any skeletal muscle, when we see, it will have something called as origin or the proximal end of the muscle. Okay, it will start at one point that is referred to as the proximal end or the origin. The central part is referred to as the muscle belly. Okay, that's the fleshy contractile part of a muscle, and the muscle will end at one point that is referred to as the distal end of the muscle, also referred to as insertion of a muscle. Okay, and between muscle belly and the insertion there is a cord-like structure that's referred to as tendon. Okay, the tendon will not have the muscle fibers. It is like a connective tissue which extends up to the insertion. Okay, so it is a fibrous non-contractile part of a muscle. Okay, so basic parts of a skeletal muscle are shown in this image. So multiple muscles we can see here. Let us just try to identify major muscles which are there in the body. Okay, if you see the chest region, this pectoralis major muscle, it's a big muscle that is seen on the chest. A muscle surrounding the shoulder, deltoid, is a big muscle. Okay, then muscle in front of the arm, everyone knows this, right? Biceps brachii. Bodybuilders usually show this muscle, right? Biceps brachii. Then if we see the neck region, there is one important muscle called as sternocleidomastoid. Okay, the sternocleidomastoid muscle responsible for neck movements. Okay, then when we see the back, there is a big muscle here called as the trapezius, a kite-shaped muscle seen in this region. Okay, trapezius. And there is one more very large muscle here called as the latissimus dorsi. It is extending between the lower limb and the upper limb. Okay, that's the only muscle which connects the lower limb and the upper limb. That muscle is latissimus dorsi. Then behind, in the gluteal region, there is a muscle called as gluteus maximus. Okay, then in the anterior aspect of the thigh, look at this muscle, rectus femoris muscle, a straight muscle in front of the femur is rectus femoris. And there is an oblique muscle which is seen here called as the sartorius. Okay, rising from this point going towards the tibia. Okay, arising from the ilium, a part of ilium called as anterior superior iliac spine. Okay, and going up to the tibia, it is the longest muscle of the body. Okay, sartorius. Then in the leg, posteriorly, the muscles are referred to as calf muscles, which includes this gastrocnemius, as well as a muscle deeper to gastrocnemius is called as soleus. Okay, these muscles, they form the bulk of the calf. Okay, in the thigh posteriorly, there is one important muscle here called as biceps femoris. Okay, just like biceps brachii is there in the upper limb, biceps femoris is there in the lower limb. Okay, so just a brief overview of the important muscles. Details of these muscles you'll be learning when you learn the specific regions. For example, upper limb anatomy, lower limb anatomy, such regions. When you study individual muscles, you'll be learning in details under these headings: the proximal end or the origin of a muscle, distal end, insertion of that muscle, the nerve which supplies that muscle, and what actions does it produce. Okay, actions of the muscles, All these headings are the basic headings for learning a muscle. Now let's cover the differences between a skeletal muscle, smooth muscle, and a cardiac muscle. Okay, skeletal muscle, as we know, it is attached with the bones. Smooth muscles, it is present in the walls of the hollow viscera as well as the walls of the blood vessels. Okay, so walls of the organs will have smooth muscles. When we say organs, heart is excluded from that, because for heart there is a specific type of muscle called as cardiac muscle, which is present in the wall of the heart. Okay, apart from heart, any other organ you name, if there is any muscle in the wall of that organ, that will come in the smooth muscle. Okay, for example, the wall of the stomach, the wall of the urinary bladder. Okay, all those have muscles that will come under the smooth muscle. Okay, so basic three different types you all should know. And what are the major functions? Skeletal muscle is for movement of the bones at the joints as well as maintenance of the posture. Smooth muscles are in the wall of the organ, so it will cause movement of the viscera. Peristalsis is a contraction in the wall of the intestine. Okay, vasoconstriction can occur in the blood vessels. Okay, wall of the blood vessels are having the smooth muscles. Cardiac muscle will cause pumping action of the heart. Okay, when seen under the microscope, there are some cellular characteristics which are seen in skeletal, smooth, and the cardiac muscle that we'll discuss now. So there is something called as striations which is present in the skeletal muscle due to the regular arrangement of actin and myosin. Okay, actin, myosin are the contractile filaments. They give rise to striations. Okay, that striations are absent in smooth muscle, and it is also present in cardiac muscle, but it is not as much as regular as seen in the skeletal muscle. Okay, then nucleus, if we see, multiple nuclei are there in the skeletal muscle fiber. For example, if we take a skeletal muscle fiber, it will have multiple nuclei. Okay, and if we take a smooth muscle fiber, single smooth muscle fiber will have a single nucleus. Okay, and the cardiac muscle is also having a single nucleus. Okay, so nucleus is multiple in skeletal muscle, single nucleus in smooth muscle, single nucleus in cardiac muscle. Okay, then how the skeletal muscles are controlled? They are voluntary control. Okay, we can do movements of the bones and the joints, okay, as per our wish, so that is referred to as voluntary. Okay, and smooth muscle and cardiac muscle, these are involuntary. Okay, then contraction and relaxation. Okay, contracts and relax rapidly. Okay, skeletal muscle contracts and relax slowly. The smooth muscle will contract and relax slowly, and there is a network of cells which work as a unit called as rhythmic contraction, which is seen in cardiac muscle. Okay, so all these are the basic differences between skeletal, smooth, and cardiac. Very frequently asked question. Differentiate skeletal, smooth, and cardiac muscle. You should be able to differentiate these three types of muscles. Okay, schematic diagrams of these muscles as well as the location of these muscles are shown here. Okay, skeletal muscle looks like this with multiple nucleus and the striations. Okay, all these are seen here. Example is a biceps brachii, which is present on the anterior aspect of the arm. Posterior aspect of the arm, there is a muscle called as triceps brachii. Okay, smooth muscle, look at the muscle fiber with a single nucleus present in the wall of the organs. Okay, which organ is this? This is the large intestine, this is the small intestine. The wall of these organs will have smooth muscle. Okay, cardiac muscle, there is one more important difference that we can see here. We can see some branching pattern here. Okay, branching of the muscle fibers, they occur in cardiac muscle, and one single nucleus is there in a muscle fiber, and there is something called as intercalated disc between the adjacent muscle fibers. Okay, that helps in rhythmic contraction of the cardiac muscle. Okay, so all these were the differences between skeletal, smooth, and the cardiac muscle. Okay, then now let's classify muscles according to their fascicular architecture. Okay, these are the types of skeletal muscles. Okay, so depending upon the shape of the skeletal muscles and the arrangement of the fibers, the skeletal muscle fibers are classified. Let's see one by one. There is one heading called as parallel fasciculi. Parallel fasciculi means muscle fibers are running parallelly. Okay, as we can see here, the muscle fibers are parallel. Muscle fibers are parallel. Okay, so if muscle fibers are parallel, it is included in parallel fasciculi. It has got further subdivisions depending upon the shape. If there is quadrilateral shape having parallel fasciculi, example is thyrohyoid muscle, a muscle in the neck. Okay, then it could be strap like. Okay, a long muscle with parallel fibers. Okay, example is sartorius muscle, sternohyoid muscle. Okay, sartorius we saw in the lower limb, and sternohyoid muscle is a muscle present in the neck. Okay, then there could be strap like with tendinous intersections. Okay, as seen in this image, strap like with tendinous intersection. Example is rectus abdominis, a muscle seen in the anterior abdominal wall, a straight muscle. When the bodybuilders develop six-pack abs, they develop this muscle, rectus abdominis muscle. Okay, then parallel fibers, which are like spindle shaped like this. Okay, parallel fibers. So examples here is biceps brachii, digastric. Okay, this kind of shape is referred to as fusiform shape. Okay, so all these are the different types of the parallel fasciculi: quadrilateral, strap-like with tendinous intersections, and fusiform. Okay, let's move on to the next heading, pinnate fasciculus. So pinnate fasciculus are referred to as unipinnate, bipinnate, multipinnate, circumpinnate. Okay, so what are these terms? Let's understand with the images here. Okay, see the images which are seen here. This is a unipinnate muscle. There is a central tendon and muscle fibers are coming from one side. That kind of muscle arrangement is referred to as unipinnate muscle. Example, it is seen in flexor pollicis longus, a muscle in the upper limb, extensor digitorum longus, a muscle in the lower limb. Okay, the arrangement of the muscle fibers are like this. So that's the unipinnate muscle. Then bipinnate muscle. Look at the central tendon and muscle fibers coming from both the sides. Okay, the muscle is rectus femoris and dorsal interossei. Okay, these are bipinnate muscles. Then multipinnate muscle. Look at this. Okay, there are multiple parts of the tendon and the muscle fibers are coming from all the sides. Okay, so that kind of arrangement is referred to as multipinnate. The more the pinnate, the more stronger is the muscle. Okay, bipinnate would be more stronger than unipinnate. Multipinnate would be more stronger than bipinnate. Okay, so this is examples are deltoid and subscapularis. For deltoid, there are a specific set of fibers called as acromial fibers. Okay, those are multipinnate. And there is one heading called as circumpinnate. Okay, so look at this diagram. Okay, there is a central tendon and the muscle fibers are coming from all around converging towards that central tendon. Okay, that kind of arrangement is referred to as circumpinnate. Example is seen here, tibialis anterior. Okay, in front of the tibia in the lower limb, the muscle is tibialis anterior. Okay, the next heading is oblique fasciculi. Oblique fasciculi means muscle fibers are oblique. Okay, look at this muscle fibers. One end would be broad, other end would be narrow, and muscle fibers are oblique. Okay, the shape becomes triangular. Examples are adductor longus and temporalis. Okay, adductor longus muscle in lower limb, temporalis is a muscle in the head neck region. Okay, in the temporal bone there is a muscle called as temporalis. Okay, the next heading is spiral or twisted fasciculus. Okay, look at this diagram. For the spiral or the twisted fasciculus, that means the fibers are twisting. Okay, so if twisting of the fibers are seen, that kind of muscle is included as spiral fasciculus. Example is seen in latissimus dorsi and pectoralis major. Okay, there could be X-shaped or a cross-shaped muscle as seen here. Okay, there are different set of fibers running obliquely like this, different set of fibers running obliquely like this. Okay, that is called as cruciform, as seen in sternocleidomastoid, masseter, adductor magnus. Okay, then sphincteric fasciculus, Sphincteric means they are surrounding an opening. For example, opening of the mouth is surrounded by a muscle called as orbicularis oris. Opening of the eye is surrounded by a muscle called as orbicularis oculi. Okay, so when they contract, they will like close this opening. Okay, so these muscle fibers are referred to as sphincteric. Okay, so depending upon the shape of the muscles, multiple types have been described. Okay, this is also a very frequently asked question. Write about morphological types of skeletal muscle. Okay, so multiple headings with examples and diagrams all are mentioned in these notes. Okay, so these are quite concise notes. Make sure you access these notes from the link which is given in the description box below. Okay, let's move ahead now. Then there is one more classification of skeletal muscles according to their roles in particular action. Okay, so there is kind of a functional classification. What function are they doing? Okay, some muscles are referred to as prime movers, also referred to as agonists. Okay, so what is a prime mover? Prime mover are the muscles which are primarily responsible for producing the desired movement. Okay, let's see what are the examples. Biceps brachii is acting as a prime mover when it produces flexion at the elbow joint. Okay, a muscle producing a desired movement is referred to as prime mover. Okay, then look at the next heading, antagonist. An antagonist is a muscle that can produce movement opposite to the prime mover. Okay, and the two muscles agonist and antagonist act in unison so that the prime mover is contracting, the antagonist undergoes a simultaneous relaxation. Okay, so for a prime mover to act, the antagonist muscle should relax. Okay, so that is referred to as they work in unison. Okay, example is during flexion of the elbow joint, the triceps brachii will work as antagonist. Okay, so there will be relaxation of the muscle fibers of the triceps brachii during the flexion of the elbow joint. Okay, so if biceps brachii is acting as a prime mover, triceps brachii is an antagonist. Okay, so just see the examples here in this image. Okay, here we can see prime mover and the antagonist. This is the arm region. Anteriorly we can see a muscle, biceps brachii. Posteriorly is the triceps brachii. The movement which is occurring here is flexion. Okay, so in flexion, biceps brachii is a prime mover and triceps brachii is a antagonist. Okay, now let's learn the next heading. Fixators. Okay, a muscle is said to be a fixator when it contracts to stabilize the origin of the prime mover so that it can act efficiently. Okay, so some muscles will stabilize the scapula and the humerus for the prime mover and antagonist to act efficiently. Those kind of muscles are referred to as fixators. Okay, so read this example. The muscles attaching the shoulder girdle to the trunk, for example trapezius, they will contract as fixators to allow the deltoid to act on the shoulder joint to produce the abduction. Okay, so if deltoid abduction has to be done, then the trapezius will act as a fixator. Okay, then next heading is synergist. So what is a synergist? When the prime mover crosses more than one joint to reach the joint where its main action takes place, the undesired movement at the proximal joint is prevented by certain muscles known as synergists. Okay, so let us try to understand what these statements mean. Okay, so can you think about examples where prime mover is crossing multiple joints? Okay, examples are shown here. The muscle which goes to the fingers, flexor digitorum profundus, it goes up to the distal phalanx, but it is crossing multiple joints. Okay, so when flexor digitorum profundus is acting at the distal phalanx, some other muscles are working as synergists. Okay, let us understand this by this statement. The long flexor of the fingers, example flexor digitorum profundus, crosses the wrist joint and can flex it, but this movement is disadvantageous if it is desired to clench the fist. Okay, if the patient wants to clench the fist, then the flexion at wrist joint should not take place. Okay, so in that case the extensor of the wrist will contract as synergists to prevent the wrist flexion. So it is slightly confusing. You will have to read 2 to 3 times to understand what these statements mean. Okay, I'll try to repeat again. Basically, the flexor digitorum profundus is acting at the distal phalanx, but it is crossing the wrist joint as well. But we don't want this muscle to act at the wrist joint. Okay, so these muscles, extensor carpi radialis, the muscle which is present posterior to the wrist joint, they will contract as synergist so that wrist flexion doesn't take place and the flexor digitorum profundus can optimally act at the distal phalanx. Okay, so that is synergist. Okay, the next heading is shunt muscle, a muscle with its proximal attachment near the joint at which it acts, while its distal attachment is at a distance away from the joint. Okay, it causes a greater range of movement. Okay, the muscle with its proximal attachment near the joint. Look at this example. Supposing this is the elbow joint, this is humerus, and this is the ulna. Look at this muscle, muscle arising from the distal end of the humerus, and it is going to a bone called as the radius. Okay, the styloid process of radius. So this muscle, when it contracts, it produces a greater range of movement. Okay, example is brachioradialis. Okay, so then another example is spurt muscle. Another type is spurt muscle, a muscle with proximal attachment away from the joint and distal attachment is near the joint. Okay, look at this muscle. This muscle is originating away from the joint and its insertion is very close to the joint at which it is acting. Okay, that kind of muscle is referred to as spurt muscle. Okay, example is brachialis. Okay, so these are multiple different types of muscles with respect to their roles in particular action. Okay, there might be a question called as functional classification of skeletal muscle. In that case, you'll have to write about these headings. Okay, if the question comes on morphological classification, then you will have to write about the previous classification that we learned. Okay, so read the question carefully before attempting the answer. Okay, let's move ahead now. Now let us understand structural organization of a skeletal muscle. Okay, any skeletal muscle, if we take a section, how is the arrangement which is seen inside, that we'll be learning now. On the outer aspect of the skeletal muscle, there is a connective tissue covering that is referred to as epimysium. Okay, and inside there are multiple muscle fascicles. Okay, all muscle fascicles are surrounded by a connective tissue called as perimysium. Okay, and individual muscle fascicles will have multiple muscle fiber, and each muscle fiber is surrounded by a connective tissue called as endomysium. Okay, so epimysium, perimysium, endomysium, these are the connective tissue sheaths which cover and bind the muscles together, and they also provide way for the blood vessels and nerves to reach inside and supply them. Okay, there are different types of skeletal muscle fibers called as red fibers, white fibers. Okay, red fibers are referred to as slow twitch fibers. The speed of contraction is slow, but they are more sustained. Okay, they are fatigue resistant, and they are present in postural muscles, long muscles of the back. Okay, the erector spinae muscle, that kind of muscles. Okay, then there is a type of muscle fiber referred to as white fibers. Those are fast twitch fibers. The speed of contraction is fast, but it will get fatigued easily. Okay, they're largely present in the extraocular muscles of the eyeball. Okay, so different features of the red fibers as well as white fibers are seen in this table. You can just read it. Now let's come to the last part of this session, the applied anatomy of muscles. Okay, so muscles are supplied by nerves. If that nerve gets injured, it ultimately leads to paralysis of the muscles. Okay, so there is inability of muscles to contract. Either there could be a damage to the motor nerves, or there could be an inherent disease of the muscle itself. Okay, then muscle spasm is sudden, involuntary, painful tightening of a muscle, as seen in muscle cramps. Okay, so many a times the muscle fibers go in sustained state of contraction. Okay, then generalized muscle spasm can occur in diseases called as tetanus, epilepsy. Okay, then there could be disuse atrophy. If we don't use the muscles become thin and weak. Okay, then there is overuse hypertrophy. Excessive use of the particular muscle will increase the size of that muscle. Okay, then hyperplasia, it is the increase in the number of the muscle fibers. Okay, it occurs in the uterus during pregnancy. Okay, then there's a condition called as myasthenia gravis. It is an autoimmune disease in which antibodies are produced. They bind to the acetylcholine receptors and block it. So the nerve impulses which are to the muscle, they are blocked. Okay, this leads to muscle weakness. Okay, although the muscles are normal. Okay, the nerve impulses which are coming toward that muscle, that is blocked in a condition called as myasthenia gravis. Okay, usually the extraocular muscles, eyelid muscles are affected first, followed by the neck and the limb muscles. Okay, so these are certain applied anatomical aspects. Okay, any question then that we write, make sure you write related applied anatomy points. Make schematic diagrams while writing the answer. Okay, that way your answer would be more effective. Okay, make sure you access this PDF from the link in the description box. Okay, and do watch other sessions of this YouTube channel as well. Thank you.